If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then online oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Welcome everybody to another episode of Be Smart, Fight Strong Cancer series. Today we will be talking about what are the different screening tests available to detect cancers. Unfortunately, we don't have screening tests for all the cancers, but we do have for some of the common ones. So we will be talking in detail about that. So the first one is the breast cancer. For the breast cancer, the most commonly utilized screening test is the mammogram. And research has shown that women who get mammograms decrease their risk of dying from cancer by 35 to 40% compared to the women who do not get mammograms. Therefore, this single intervention is so important for all the women, and more so important if you have a positive family history or if you carry some genetic mutations, because it can really make a huge difference. The mammograms are typically started at the age of 40, and they are continued till somebody's life expectancy is 5 years or more. Now, this is the recommendation for the standard, so to speak, average risk patient who has no family history, who has no genetic mutations. But if you have any of these scenarios in which you had a family member at a young age and got breast cancer, or if there are some high-risk mutations like BRCA1 and 2, then the recommendation is to start these mammograms at a way younger age compared to when you start in the standard patient population. Knowing the family history is very important, and knowing your individual risk profile is important, which your doctor should be able to tell you as to what is the right age for you to start getting mammograms. For those patients who are at a very high risk, we advise additional MRI of the breast, especially if you are young, because younger women have dense breasts, so the mammograms do not pick up all the problems, and MRI is kind of a more detailed study to do if you are high risk and if you are young. In my practice, what I usually do is that I get an annual mammogram and MRI of the breast, and I split them every 6 months, so that every 6 months the patient is either getting a mammogram or an MRI. The next screening test we're going to be talking about is for the colon and rectal cancers. Diagnostic test of choice to screen colon and rectal cancer is a colonoscopy. That is by far the best way to screen for these type of cancer. The recommendation is to start screening at the age of 45. For a long time, the age was 50 for average risk patient. However, now the United States Preventive Task Force has decreased the age to 45. So everybody should be getting a screening colonoscopy when they turn 45. However, for patients who have a family history of colon cancer, especially a younger family member with colon cancer, should start getting colonoscopies at a way younger age. So for example, if you have a blood relative who got colon cancer at the age of 40, then you should start screening colonoscopy at the age of 30. So 10 years earlier than the youngest person who has contracted cancer in that family. So that's why it's important to know your family history and your risk profile, and you can discuss that with your doctors to know the age at which point you need to start screening colonoscopy. The same goes for some families with certain high-risk mutations or certain syndromes that are running in their family, like familial adenomatous polyposis syndrome or Lynch syndrome. These are the families that require screening colonoscopy at a even much younger age, probably in some situations even before the kids start to enter in their teenage years. And sometimes some of these mutations are so bad that the cancer doctors recommend prophylactically taking out the colon, because it's almost certain that they will get the colon cancer. Therefore, very important to have these discussions with your doctor about what's your family history, what's your risk of contacting any of these cancer, and at what age you should start these screening protocols. In some parts of the country, there are no gastroenterologists, or the patients have a problem with their insurance covering for these tests, or they do not have insurance at all. Then we do a poor man's test, and in this test your doctor will ask you to give your stool sample on 3 consecutive days, and we check the stool for any occult blood. We process that stool with a developer, and that's how we know if there is any occult blood in your stool or not. And you may never experience any bleeding, and you may not notice any blood on your stool, but this blood can be occult, and if somebody has a positive testing on that, then they definitely need a colonoscopy to make sure that they do not have cancer. Anybody who is above the age of 50 and has anemia should have a colonoscopy to make sure they don't have colon cancer, because anemia is a very common sign of colon cancer, because these patients lose blood slowly over time from the blood oozing through that cancer. So the next on the list is the Pap smears. Now, Pap smears are the screening test for cervical cancer. Everybody should get Pap smear at the age of 21. That's when you start. However, if you are sexually active, then 3 years after the first encounter, you should start getting Pap smears. Usually Pap smears are done up to the age of 65, and then you can consult with your doctor if it is safe for you to stop taking this test, especially if your previous 3 Pap smears have been normal. The next on the list is the screening for lung cancer. Now, this is relatively new because we were not doing any screening test for lung cancers. However, lung cancer is a major health problem in the community. Now we have a low-dose CT scan that we do in patients who are eligible to go through screening for lung cancer, and the eligibility criteria is if you have 30 or more back-year history of smoking, if you have quit smoking within the last 15 years, or if you are between the age of 55 and 80, then you should undergo a CT scan of the chest to look for any suspicious lesions. A lot of times we see, which are not suspicious for cancer but are not quite normal lesions either, called pulmonary nodules, and based on what the score you get on the CT scan, your doctor may advise you to repeat the CT scan in 3 months or 6 months or in 1 year. If your CT scans are fine, then you can get a yearly CT scan for up to 3 years in this program. The next on my list is the pancreatic cancer. There are no FDA approved or very validated screening test for the pancreatic cancer, and most of it, you can call it, is being done on a trial basis, and people who have high risk mutations that put them at a very high risk of developing pancreatic cancer can undergo endoscopic ultrasound, which is a procedure usually done by a gastroenterologist to screen for pancreatic cancer. And this is a very unusual situation to have that type of mutation, and it is relatively a rare type of mutations. But if people have those high risk mutations, then they should definitely have a discussion with their doctor or gastroenterologist about screening for pancreatic cancer with a endoscopic ultrasound. The next on my list is the ovarian cancer. And ovarian cancer screening is also something not very validated and widely practiced. And there is no good data in the general patient population that screening for ovarian cancer alters the mortality. So there are big studies done which have not shown any good results, and that's why the screening for ovarian cancer has been restricted to high-risk patient population, and these high-risk patient population are the ones who carry certain mutations like BRCA1 and 2 mutations, and in this group of patients they may benefit from getting screening for ovarian cancer. It's done by two modalities. One is a transvaginal ultrasound, in which ultrasound is done every 6 months to look at the ovaries and to look if there are any suspicious lesions or not. And the other test is actually a blood test looking for a tumor marker called CA125. And these are the two means by which we screen for ovarian cancer in select high-risk patient population. But the general patient with the average risk, it is not recommended. So these are all the basic screening tests available out there for the different types of cancer, and unfortunately a lot of other types of cancer we do not have any screening test because none of the modalities have been shown to decrease the mortality by doing that test. Hence it's of no use to do that test. However, I would like you to see my video on how you can prevent and decrease the risk of developing cancers. Therefore, visit my YouTube channel to look for other videos, and you can also visit my website www.onlineoncology.com to look for other videos and see how you can benefit from all that information that I have out there. Thank you very much.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.